Okay. Let me also, in fact, try and get in our other guests at this point as well. Dr. Vivek Gupta, let me draw you in here at this point. Dr. Vivek Gupta, do you believe this is a time for a COVID red alert in the country? This is a time for an Omicron red alert in the country? Do you believe that Dr. VK Paul's warning should be taken seriously, or are we over-imagining?
No. I don't think we are over-imagining. We have already we have already really been a big problem during the COVID wave 2, and once bitten, twice shy. And in fact, we have been bitten twice. We have to be twice bitten, thrice shy. So what I will see that if Omicron is 3 times more infective than Delta, and if the number of cases are going up like spirally in France and UK, and the elections are on here, and the things are going so pretty well everywhere, without major masking and sanitization or the social distancing. And let me tell you that social distancing and sanitization is a little more of farce, but I would say that mask is very important. So if he says that 15 lakhs cases per day may be seen if the third wave comes in, then of course 15 lakhs means 15 lakhs, because when we see 4 lakhs per day cases during the COVID wave 2, we were always saying that we are not testing that much and maybe we are missing some data. So I believe that during COVID wave 2, we were having at least 8 lakhs cases per day during the peak of the COVID wave 2. So what we have to do? We have to be really very cautious this time. Although we are finding reports from South Africa as well as from USA that this virus may not be that virulent as Delta, but we are not too sure about that. Of course, we are no more vaccinated at this point of time. We have a herd immunity. We have a long-term immunity. Those who have 70% of Indian population already infected. And antibodies are not the real marker for their protection. It is B-cell and T-cell immunity, long-term immunity, cellular immunity, which cannot be measured by any criteria as of now, lab criteria. So we are more protected than wave 2. But considering that if so many patients get infected during wave 3, if at all it happens, then of course we have to be a little more careful, because still there were few percentage of patients will require hospitalization. And those who are, if we say 70% infected, 30% still not infected. If 30% population gets infected by this Omicron, I would say that we have to be very, very careful. With a large population of under 40 crore population, 30% population not protected means at least 30 crore or more, 40 crore population not infected, not protected, neither by vaccine nor by innate immunity, which means that they have been infected earlier. So 40 crore population is a huge population. It is 5 times more than British and 5 times more than France, which is only 8 crore population. So this population is not protected. Therefore, we have to be very, very careful. We have to stop doing conferences for the time being, only 2 months. We may stop the flights. We may have a rigorous criteria for masking. We may have in the form of red alert, what you say. That means at least we should have a challan and all those things. We have to be something like what we did in April after the COVID wave 2 came in. So we should not do like this as we did last time. We have to be very, very careful, because 40 crore population not protected neither by innate immunity, which is when you get infected, nor by vaccination. And there is a huge population of our country. We have to be very, very careful. Don't take it under, and red alert is important. Dr. VK Paul, I know personally, is a very fine man. He does not state anything without the data. And if he has said something, we have to take it seriously. India, we cannot afford to have another third wave like wave 2, where more than so many lives were lost and 4,000 deaths were happening, which was actually data which was always debatable whether it was actually 4,000 or even more. A lot of dead bodies we saw in Ganga and Yamuna. So we don't want to have that. We have to be really protection. So what is the way out? The way out will be vaccination. You cannot increase immediately, but booster dose, I would still say, because I got, for example, I gave my example. I got the second dose of Covishield in February. Now I am 10 months away. Almost 10 months. I have not checked my antibody level, but I feel that I should get a booster dose. So booster, when you have a lying extra doses of million doses, SSI says, Serum Institute of India, SII says that they can build more Covishield. So what is I don't know what is the hitch in the mind of the government not to be able to decide for the booster doses, which is going to be really helpful for those patients who have not got COVID earlier. So I would say the government should take immediate attention to giving the booster dose, allowing the booster dose, especially those who have crossed 6 months of the second dosage, and especially the healthcare workers and the patients who are diabetic or hypertension or heart diseases around 60 years of age. Similar criteria what we had. The first, you see, the first vaccination started in 16 January 2021. And that was a time when we had a strict criteria that only those particular patients, only healthcare workers, then came more than 60 years, then came less than 60 years, then came less than 45 years. We have still not done vaccination for the 12 to 18 years, but they are more protected, I would say. I would say the children are still not that vulnerable. The reason is, whatever virus, they have a better immunity than the patient of 50-year-old who is hypertensive or diabetic, or any healthcare worker who is in the age of 50 to 60 years. So I am not concerned about the children getting vaccination. I'm more concerned about the booster dosage for those vulnerable population which have already crossed the 6 months and there is no way you can only test the antibodies. I don't want that antibodies should be tested. It's impossible to test the antibodies of such a large population and then go ahead for the booster. 6 months crossed, go for the booster. That is going to protect from third wave. I personally feel that third wave, if at all, you see, here is one Niti Aayog, and this is one doctor who's talking, because I follow the patients very regularly of my COVID. I still say, when I did a Facebook Live, I said third wave is possibly not coming. The reason why I say, because when I say 70% population is already infected, but when I check the herd immunity, serosurveillance, which has been done in Delhi, is about 96% or 90% in Delhi, otherwise 80%, 70 to 80% criteria. Third wave means what? More than 1.5 lakhs per day, if you start having per day, then of course third wave. Let me tell you one more thing. We have to increase our testing. You see, England is testing about 18 cases per 1,000. We are testing as of now only it is less than 1 per 1,000. During the peak time of COVID wave 2, we tested 3 patients per 1,000, 3% per 1,000. So we cannot reduce the number of testing, because that is the only way you will come to know the exact number of people who are getting infected, because the numbers are very important. As of now, we are very happy that only 7,000 to 8,000 patients per day is coming as far as COVID is concerned. That's a very good news. But when I was comparing, because I just came to know that what England is testing is 18% person per 1,000. What we are testing is around 1 per 1,000. As of now, we have to increase our testing. We have now, under the Prime Ministership of Minister Narendra Modi ji and the Health Minister, we have a large people who can be tested. We are not short of the RT-PCR kits as of now. Earlier we were. We are not short of RT-PCR kits. We have a huge number of people who can actually be a huge number of people who can really utilize our manpower to test the people.
Dr. D.K. Gupta, do you believe also, like Dr. V.K. Paul has said, that there could be that many lakh cases, 14 lakh cases every day after this Omicron surge? Can we prevent that, or are we headed in that direction already, Dr. D.K. Gupta? Because we are all seeing how the UK is breaking record day after day, and that is being attributed to the Omicron.